Bio-Psychosocial-Spiritual Model. The reason why I've mentioned this model is it's a model that's well known in the mental health professions. So if you spoke to most people working mental health, if you said the biopsychosocial model, they would understand that. But there's been a widening of that model to include the spiritual component, which we know is very important, particularly in terms of thinking about the Muslim population that we work with, and also from the Islamic model of the self. So this model maps quite nicely onto the Islamic model of the self. So for example, this psychological component might be more to do with the akal, the biological component might overlap more with the body, the social component, we think about the environment, the spiritual component, we think about the qalb. But as we know, these categories, they are linked together and there can be quite a lot of overlap. So when we think about the biological, we can think about people's genetics, their age, their gender, their physical health. The psychological, we can think about their coping skills, their IQ, their memory, the impact of trauma. So I think in the chat, somebody talked about childhood trauma. So there's a huge correlation between childhood trauma and difficulties in mental health difficulties in adulthood, people's temperament, self-control, self-esteem. When we think about the social, we think about people's family, their occupation, their community, their socio-economic status, their educational status. When we think about the spiritual level, we think about their belief in Allah subhanahu wa ta'ala, their belief in God, greater meaning and purpose of life, their religious practice, and other influences like jinn and black magic.